Yeah, I mean, I completely agree with you about what you said, having a passion project. I share the sentiment. I think that sometimes it can be counterintuitive that why would doing more things actually contribute to your well-being? Because aren't you going to just be more busy, and residents could benefit from for a variety of reasons. But I think if someone learned about this, in the first month of their intern year, they may not have the free time to try to go and explore it.
Today, our guest is Paulius Mui. Paulius is a family medicine resident at Shenandoah Valley Family Practice Residency Program in Virginia, where he's about to finish his internship year. He attended the Virginia Commonwealth University School of Medicine, and before medical school, he was an executive assistant at the Harvard Medical School Center for Primary Care. He's also the resident director for the Virginia Academy of Family Physicians and the co-founder of Table Rounds, a card game to discover hidden connections in medicine. He's passionate about medical education and practicing primary care in the rural communities. I hope he didn't leave anything out.
No, that's perfect, Gerardo. Thanks for having me.
Excellent. Well, in a few weeks, interns are gonna start their residence. So I think this is a perfect opportunity to ask you a few questions about that. Well, it's a pleasure to have you, and thank you for doing this interview. And first, I wanted to congratulate you for almost finishing your intern year. How does it feel to be almost over with the hardest part of your residency?
Thank you. I cannot believe the end is almost there. My first year actually wasn't too bad. I hear that the second year in my program turns out to be a little bit more difficult. I don't know why. I do think overall the learning curve in residency is certainly steep, and it's maybe not so much the medical learning curve that is so steep, but possibly some of the emotional weight of being a new physician and having a whole other level of responsibility on your shoulders. And when you're talking to a patient, they're seeing a physician. They don't know if you've been out in practice for many years or if this is your first week as a physician, and you still have the same obligation to give them good care and sound confident and know what you're talking about. And to me, that was kind of the scariest part. As when I was starting out, I definitely feel a lot more comfortable doing all of those things right now, but I still think I have a lot to go in the next 2 years before I'm an attending.
Yeah. So when you started, I guess the pandemic started when you were a medical student, and then you experienced the worst part of it when you were an intern. How did it affect your residency experience?
Well, I've only got one residency experience. So to me, this is, I really didn't have a whole lot of other expectations that were not met. I certainly, it was a little bit surreal when, as a medical student, I could not complete my ICU rotation, for example, which was towards the end of my training in person. We had to do it online because all medical students were prohibited from going to the hospital for safety reasons. There was not enough PPE and all of that. And then the pandemic was continuing, on, and then we became residents and now had to jump into everything and take care of, of patients that have COVID. And it just, I went from reading about it to actually practicing and having patients on my panel that have the diagnosis that seemed somewhat somewhere else in the world, not necessarily in my everyday life, and so that was very much a surreal experience. I think connecting with my cohort has definitely been more difficult because a lot of the social gatherings and any of the activities that normally happen at the end of rotations, kind of the end of block parties, for example, they're called in our residency where residents and their families get together and get to know each other and so on. None of that happened. So I think to me, maybe that's the part that I was missing out. And I feel like also being a family medicine resident, we see a lot of acute care visits in addition to chronic care and well visits. And a lot of the acute care visits, if anything had to do with respiratory system or, some of the even more vague COVID-like symptoms, people were sent off to cold clinic, and interns were not seeing patients in the cold clinic. So, I think in that regard, my first year has been somewhat unique. We started seeing patients in the cold clinic eventually, but it wasn't right off the bat. So we jumped into a lot of chronic care follow-up visits when we really didn't have a whole lot of experience. So that was interesting.
Yeah, I just find it funny. You call it cold clinic. In our hospital, we call it the hot zone where all the COVID patients are.
That's really funny.
And then you just reminded me of the beginning of the pandemic where we were reusing our mask, and we were very careful of PPE because we were limited. It was just quite an experience. Did you had to deal with a lot of ICU patients, or at least learn like mechanical ventilation management early on?
I actually did not have to do it as a resident. Our program is a rural program, and so we have a curriculum that's specifically tailored to kind of our community's needs, and we don't get into managing ICU patients our second year. For example, one of my first rotations in the upcoming year is going to be a NICU ICU, neonatal ICU. But I don't think we actually do a formal adult ICU training until third year at a bigger hospital. But coincidentally, or I guess, I don't know, not coincidentally, but interestingly, we do have most of our second year inpatient is in a smaller hospital, which does have a step down unit, and it's kind of the ICU level care patients are there. So I'll be managing those. So I have not had to directly take care of patients, but we always, we accept patients from the ICU and we transfer them to the ICU. So you still have a lot of overlap with some of the ICU docs, and you need to know what's going on.
Excellent. I think you're looking forward to get that experience.
Mm-hmm.
So, in a few weeks, 33,000 interns will start their residency. Why don't you tell us what is a typical day like as a family medicine resident?
Well, that's a good question. There's really not a very typical day because we do so many different things. I can kind of pick maybe more of like an inpatient rotation and describe somewhat of a typical day on that service, which I think is probably not a whole lot of different from other specialties. We have a sign out in the morning, like at 6 a.m. So that's one, you come in a little bit before that, kind of sign out the patients from overnight. And then you have your roster of patients to pre-round on. And then in our program, we work directly with attending. So we don't have other residents on our team that for the patients that we care for. So pre-round on patients. Sometimes we also have a lecture in the morning. So I start pre-rounding, chart pre-rounding, and then go to a didactic. Sometimes I present something at a didactic, then finish pre-rounding, and then meet up with the attending and review the plan for the day. And usually by that time, notes need to be written before meeting with the attending. And then if a plan needs to be tweaked, we do that. And we start out with discharges, and then there's probably a lunch lecture of sorts during the day. Sometimes, even if I'm on an adult service, we might have a pediatric lecture to go to. And then in the afternoon, it's a lot of admissions, and then sign out again to the night team is at 6 p.m. And that's kind of a typical inpatient day, which is a bit longer. And then on days where I have clinic, sometimes you start out inpatient for a half of the day, and then you go to the outpatient setting for the second half of the day, where you see patients from, right after lunch to about 5 p.m.
Yeah, I think all the residency programs in the US have a similar curriculum. At least in my experience, it was like very heavy inpatient the first year. And then towards the end of residency, you're more geared towards outpatient. And
Yeah.
I can't remember if it was 1 or 2 days of clinic while you were doing like half days of clinic while you were doing your inpatient rotations. Uh, but yeah, that's nice. So I know you're passionate about practicing in rural setting, but what drove you to choose a career in primary care in the first place, and why did you choose to train in the residency program you are right now?
Good questions. I think so I'm a little older going into medical school, and I took, my 20s to kind of get to know myself and understand what drives me and what my interests are. So I went into medical school knowing that I want to do family medicine, and I chose VCU in Richmond because of the strength of its family medicine program. They had a special family medicine scholars track that I was part of, and that really won me over. And the reason I chose family medicine was because no other specialty made sense to me. I mean, I did not want to not be able to help anybody who came through the door. Like, I may not be the last person to take out their tumor or give them radiation for a cancer or like fix their broken bones, but I wanted to have as complete of a skill set from a physician's point of view to care for undifferentiated patients that were of all ages, and that, things affected all of their body systems. I didn't want to say, I'm sorry, this part of your body is like not my specialty, I cannot take care of you. I wanted to be that. Some people, disparagingly call specialists partialists, but I think we're all team members of a team caring for the patient. So I think everybody has a role, and we would not, primary care would not be as strong without the assistance of all the specialists that we have access to. So to me, it just I wanted to be in a small community and to be a real asset to the people with different needs. And I think primary care, and specifically family medicine, in which you're really trained to take care of everybody, kind of, you can deliver babies, you can take care of the pregnant moms, you can take care of their parents and grandparents, and you can do the school physicals. I just loved all of that.
Yeah, it's funny you mentioned you took your time to learn what you wanted to do with your life. I went to medical school in Mexico right after high school, so which is like most of the world does that. But I guess you get more mature people here in the U.S. that are entering medical school. So, what would you recommend a medical student to look for in a residency program?
I mean, I really think it depends on what kind of person they are. I think I would echo the same thing I just said about knowing what you want. And then once you figure out what you want, looking for those things in the program. And so the advisors that gave guidance to me is, a lot of the times it's location for people. Some people know they want to be either close to family, or they want to be in a city, or they want to have access to different opportunities. They have different family dynamics they need to juggle. So I think if, I'm using generalized advice, I would say that figuring out what type of setting and location you want to practice in, maybe regionally narrow down to that. And then you can kind of begin to pile on like what other things are important to you. For some people, for family medicine, for example, one fork in the road is the program opposed or unopposed, which means
Yeah, I was
that,
going to mention that.
yeah, do you have other specialties training in your system? And so, if your goal is to be proficient at delivering babies, but there will be obstetric residents and you have the same number of patients, it's most of the deliveries will go to the patients, to the residents who are in OB, and you'll just get to assist, as opposed to in our program, there are no OB residents and we're the only ones doing everything. So that's an example of an unopposed residency program. So I think that's, one thing you want to think about. I think, if it's possible, doing a rotation where you want to be will really give you a feel for what it feels like to be there, and paying particular attention, I think, not only just to your co-residents, but also the nurses, because honestly, you work a lot more with the nurses and the office staff than you work with your co-residents. And so just seeing if the dynamic that is there seems that it fits your personality and like what your expectations might be, and if that feels exciting to you, I think it's a good match.
Yeah, I think that's a great recommendation. Be nice to the nursing staff and the staff in general. The whole make your residency so much easier.
Yeah.
I was just gonna share something with you that when I applied to residency, I wanted to go to an academic program because of the prestige of the institution, right? And I didn't get in, and I got into a different program that was unopposed, and I wouldn't have any other way. I mean, it was such an amazing experience because you were able, like you said, to deliver all the babies you wanted and do all by yourself. So you're also in an unopposed program?
Mm-hmm. Yes.
Yeah, that's amazing. So are there any things you wish someone told you before starting residency?
I was asking a lot of these questions leading up to residency, so I feel like I've really done my homework. I always can learn more. I think the things that I kept hearing over and over again as I was exploring this question is the medical part will come through repetition. And like I had this desire just to kind of like have my medical baseline knowledge down much earlier, so I don't need to worry about it. But there's really no shortcut to it. You just need to go and see a lot of patients and repeat a lot of things until it finally clicks to you. Like, yes, you can study the book knowledge, like, like forever, but you forget this stuff. But when you actually take care of patients, like, you remember things very differently. And I think combining those things, will eventually, like, you just have to trust the system that people become competent by going through training, like, as baseline.
Yeah.
And I think the things that you can work on are the things that really, one, make you like a human being that is well-rounded and not just one-dimensional. So, have other interests outside of medicine. Think about what your priorities are. Like, be the kind of physician that your patients would expect you to model, like the behaviors that you're trying to counsel about. So, like, be your best version of yourself, and like finding a way to make whatever that means to you, to make that thing happen. Like, we counsel about exercise and eating well, and having a healthy mind-body connection. And you don't need to like meditate every day and exercise every day, or like eat organic and whatever. Like, I think as long as you have some practice that makes sense to you, whether it's exercising every other day or a couple times a week, or doing meal prep, it's just like having a system for all of that, so that you're not having to try to figure that out on top of residency. And I think a lot of this advice applies to people going into medical school too, because you have a lot of the same time pressures and expectations to just perform and kind of deliver good patient care in a way. And so for you to be able to do that really well, I think you want to find a good routine for sleep and taking care of yourself. And again, all the things that I mentioned, I think if you can get that down leading up to residency, then the rest will come. I don't know if you would agree, or would you add anything else?
Yeah, and I was gonna tell from what you saw, you told me earlier. I mean, practicing medicine is an art, and you won't learn that in the books. Only by actually doing it and how to engage with the patient. I mean, that's something that you just learned by, I guess, by seeing other people doing it and then doing it yourself. But you started to talk about some of the residency life hacks. That's my next question. And so, what tips can you share with medical students and new interns to survive residency?
Well, I mean, I think you want to be in a place where you are not necessarily trying to reinvent the wheel. So I think have the structures, some of the ones that are wellness related that I already mentioned, try to have those things figured out, but also try to figure out what kind of resources you're going to be using in residency, so that you're not like, I'm the kind of person who loves to just find new resources, and then when there's another new resource, I also like to, add it to my list. And sometimes I just spend more time adding resources than actually using them, which is I think could be the downside of the whole process. But figuring out the things that you're going to stick to, if you like podcasts, like figure out which medical podcasts you enjoy listening to. If there are different medical calculators that you use, like preload your phone with all of those apps, become familiar where they are. I think this is kind of where we intersect. I think the product that you've developed, ChartNode, is one of those tools that I think a lot of residents could benefit from for a variety of reasons. But I think if someone learned about this in the first month of their intern year, they may not have the free time to try to go and explore it and figure it out in the same way that if someone learned it in weeks leading up to residency, where they have the time to play around with it and figure out to set up their phrases and templates, and so that when they do start seeing patients, like they have a reference system to look up.
Yeah, thanks for the free advertisement. But I agree. I mean, I think the first two things is sleep well and exercise. Even if it's just 10, 15 minutes a few times a week, it makes a huge difference to get rid of all the stress and anxiety from especially the first year. But those are great recommendations. Do you have any other like daily practices or habits that you develop to consolidate your and develop your clinical skills and knowledge?
I mean, the things that I like to do is, I have like a note-taking system that I feel like I'm always refining, and there's different tools that you can use, but I figured out what works for me. And I wanted something that I could access from my phone, also from the computer and any browser. And I wanted something that is very simple and can have pictures. And so I've been streamlining that process for myself. And I've been trying to just kind of, I think as med students, we don't know what we need to know. So we end up trying to know everything, and that is not efficient. And so even like resources like UpToDate, like it's a great expert opinion website, and it has guidelines and other things. And often it is not practical to use it when you're in a patient visit because there's just too much information. So figuring out what is pertinent, you kind of need to have that, I think, in a more digestible format. And there are resources that give that to you, but I've just been trying to develop my own resource so that when I know that I'm doing a diabetes follow-up, this is how I approach it. In 10 seconds, I know the things that I should not forget. And when I'm choosing hypertension medications, I have my go-to medication list, and this is like the starting doses and so on, instead of having to go to UpToDate every time and like read through paragraphs and figure out what's relevant. So I think, that's a helpful practice. And then as a routine, I think I like to read up about patients as much as I can after I see them, so that I try to couple that learning. I think there's a lot to be said about emotional memory. So as we have an emotion from whatever reason, and we tend to remember those things better. There's a bunch of evidence from the from, kind of psychological sciences for that. And so I think like for me, patient encounters are often emotional experiences in different ways. And so if I can take that and couple it with knowledge, then I tend to remember it better. So that's, I think, one thing I try to do consistently.
Yeah, it's earlier on we were talking about how I use Evernote to kind of like make notes of my pearls, and you use what's the app do you use? Note or
I like to use Google Keep, which is,
Google Keep?
it's part of the Google product line. And so if you have access to Gmail, you have Google Keep, and so there's a phone app. There's also, you can access it through a browser.
Yeah, that was a hack that I discovered by myself. No one told me about it, but it's funny that you're also using it. I think it's really valuable to have your pearls of information, and then whenever you need like a quick access, you just type the keywords and you have the information right there.
Yeah, I think part of it is so it's like the reason we go to UpToDate is because it's experts who wrote it, so we trust them, right? And then when we go to PubMed, we look at published studies and reviews, and like there's an element of trust. But when you go to a blog, it might be accurate and correct, but you can't trust it the same way. At least you shouldn't, right? Like you should have some sort of a filter. And so developing a note system that you trust, because ultimately it's you who created it, I think it really cuts away all the layers of doubt, and you write it in the language that makes sense to you.
Yeah, I remember seeing a lot of residents that have like a notebook that was their Bible, but I can imagine being a patient trying to look for some information that you wrote at some point. I think our system works better.
Yeah, and this is maybe if there's enough interest, I'm happy to like write up how I use Google Keep for my note taking, because I've incorporated using like dot phrases to be able to pull up things quickly, because Google Keep limits how many tags you can do. It caps you at 50. And so there's a different way to tag your notes just by using dot phrases, essentially. And you can filter notes really quickly.
And Google Keep allows you to take pictures and has like OCR, optical.
Exactly. Yeah. So like if you take a picture of something, and that word is in the picture, it'll be part of the search, which is
Evernote does the same. We should co-write an article.
I like it. Okay,
we should do that.
Okay,
I'll put it in my to-do list. Anyway, so talking about writing, writing notes is one of the main causes of physician burnout. Do you have any EHR medical documentation hacks? You mentioned you use my app, ChartNote, and the dot phrases. What else do you use?
I mean, I think a lot of the stuff is very local, and so making sure that you get your dot phrases from residents that are graduating, or residents who are just finished, their intern year, because they're the ones that are going to be closest to the phrases that you're going to be needing to use for discharge, notes or admissions or whatever. Some attendings just want specific things, and I think part of the game in residency is knowing how to deliver on that. And so it's, having access to the things that attendings expect from you is I think part of the battle. And so someone else suggested that I also look up when interacting with specialists in my hospital, you get, because we use Epic, for example, and so you're able to look up the dot phrases in across other physicians, right? And so if you know who the specialists are, you can look up what phrases they have in their templates, and also adapt them and learn from them to see, okay, this is when they see a patient with chronic kidney disease, this is the thing that they care about. This is what their standard of care is for chest pain workup, from a cardiology point of view. And then that way, you shouldn't just blatantly copy that, because you need to, justify everything that you're writing, but it can give you a scaffold for why, for what's important, and also it can, you know, serve as a starting point if you don't know where to start. And I think you should then also question, you know, why are they including these certain things? And if something doesn't make sense to you, then go and look it up. And maybe you realize that these things really shouldn't be in the note. And then I think that's where the community of ChartNote comes in, where you're trying to create a member base that ends up sharing their favorite dot phrases and with each other, and then people can copy and modify them, and just kind of keep building on that collaborative knowledge structure, which I really like. I'm curious to see how this will evolve, and you know, excited to add on to what I can.
Yeah. I think that the community component of Charm is a great way to residents and colleagues to share templates. I mean, I was gonna tell you. I mean, I feel like this is such a big problem, and um, it should be part of the curriculum and residence training, learning how to properly document or be efficient, and not only with dot phrases, also like with dictation. I mean, a lot of physicians I see, my colleagues don't dictate, and when I ask them why, it's like, well, I never got used to it, or really learn how to use it. But it's like you dictate 130 words per. I'm forgetting about the numbers, but it's much faster than typing. So that's an important. And by the way, let me do a bit of commercial. We're gonna release some really nice voice recognition in Charnote. You should try it.
Yeah, so tell me about it. What I didn't so when I tell people about ChartNote, they just think that it's a template, you know, like website. But I have a hard time explaining to them that there's also a voice component to it. So can
Yeah,
you
you know,
tell me what that is? Yeah.
in my experience, at least in primary care, you get a lot of patients, and they come for the same reasons, and so it's kind of repetitive uh, documentation. You ask the same questions. You use templates, the dot phrases, but other times they come with more complex, especially in inpatient. Most of the time my HPI, it's dictation, because you know they come with different presentations, and then the assessment and plan. Once you figure out what's going on, usually it's the same treatment, right? So I use a dot phrase there. So if a patient comes with a syncopal event, usually the history that led to it, it's more convoluted, and it's easier if you use a dictate. I mean, you can type it, but if you dictate it, it takes a couple of minutes. And then the assessment and plan, I use a dot phrase, and that way and the same thing for a physical exam. I use a template, and then I just adjust according to what the presentation of the patient. But we'll release it in a week or so. So keep an eye for that. Let me move on to the next question. What book, apps, or resources would you recommend for medical students and interns? What's like your top three apps or books?
Oh, it's hard to pick top three. It's, you know, it's
Or,
like pick
are you,
your favorite friends or whatever, you know. It's like it's not fair to everybody. I think, you know, I can kind of maybe run down a list of the ones that I tend to reference quite a bit. You know, this is maybe more family medicine specific, but I think the USPSTF app that
yeah, definitely.
helps you remember all the chronic care and well visit stuff. That's a must. AFP Shots app is helpful for knowing the immunizations. The ASCVD Plus calculator, you know, anybody that has atherosclerotic risk factors, and when you're checking your lipids, this is kind of the numbers you plug in to figure out if they should be on a statin. And then when I was in an emergency medicine rotation, WikiEM is a cool app. It's free, and it's a lot of emergency medicine residents actually use it. As a med student, I got the Sanford antibiotic guide, which is really excellent. It's quite pricey, but I think it's worth it because you can really isolate the drugs and bugs, and you can like cross-reference their coverage and modify all these tables. I'm really impressed by it. GoodRx is another app that is good for comparing prices of different medications locally. So just because you know what the textbook treatment is for something, that's actually only half the battle. I think the real battle is making sure that the patient can have access to it and afford the medication, because just because you write the prescription, it doesn't mean that they're gonna, that's gonna lead to a good outcome if the patient cannot afford it. And so sometimes figuring out like how much their insulin is going to cost or how much certain meds are going to cost to the patient. One way to do that is by using GoodRx and looking up prices locally.
Yeah, yeah, I'll definitely add a link to all the apps you're telling me about. And what has been the most challenging part of residency so far?
I think the most challenging part of residency has been trying to just juggle, the responsibilities of resident with like my other interests and different opportunities that come your way. And I think it's pretty exciting to be where I am. And I really thrive on challenge, and so I welcome it. I feel like sometimes I also look forward to a time when maybe I won't have so many things happening and it'll just be more chill. Uh, but I think I think I'm at the right place right now. I think making sure that I get enough sleep is probably the most realistic challenge.
Yeah, I was gonna add, and you mentioned this before. We talk about sleep and exercise being really important as
Yeah.
your hacks to surviving residency, but also having a side project or a hobby, and being passionate about it. It's a great way to fight burnout, because you can forget about all the stressors from work and just kind of release your creativity. And in your case, you have so many projects like the open, I mean, forgive me, table rounds. I was gonna say open tables. The you have to make reservations. No, it's actually, and let me do a commercial for you. So it's playtablerounds.com. That's where you can find the game, right?
Yeah. I mean, I completely agree with you about what you said, having a passion project. I share the sentiment. I think that sometimes it can be counterintuitive that why would doing more things actually contribute to your well-being? Because aren't you going to just be more busy and, more tired and not get enough sleep and all of that? But I think that actually there's something about the, putting in money in your emotional bank, so to speak. I think that if you have things to look forward to, they can actually energize you and sustain you from one day to the next. And that even if there are days when you don't get as much sleep as you'd like to, you might, I think you just the idea that you're working on something and growing and you're building on a project and learning new skills, in parallel to doing similar things with, your medical training. I just think a lot of the things are reinforcing each other. And so that's why, like, I think exercise works in a similar way. Like, shouldn't you relax by sitting on a couch and just like literally relax and like rest and not do anything? But you go on a run and you like exert yourself, the opposite of relaxing, but then you end up feeling so good. You have all these endorphins and like, and then you have like a different like appetite for things. And you like, even if you wanted to eat a bag of chips when you were relaxing, you come back from a run and you're like, you know what, that bag of chips doesn't look that good. Like, I actually want to eat something that is maybe like healthier. I want to cook something or make a salad or whatever. At least that's been my experience. So, and so it's weird how these things that we think are going to take more time actually benefit us. And I think working on a passion project is very similarly. And so you brought up table rounds. Absolutely. I mean, this is a game that my friends and I created it as medical students, and it's continued to grow, as I've transitioned to residency, and my friends just graduated from medical school, and we will continue, trying to improve it, make it better, make it more available to people. There are different ways to, do research with this game and study learner development. I think it's a really exciting project. I mean, at its core, we've created these cards that have medical terms on them, and the idea is to relate them to one another and explain how they connect by creating teaching points. And then you can play this game with medical students and use it as an educational tool. And I think it infuses a little bit more of the human connection and playfulness into your everyday life in medicine, and it makes maybe some of the less exciting things more exciting, and it connects you with your peers. And so, I believe in all of those things, and that's why I think table of rounds is a really cool concept, and I hope that it reaches a lot of the medical trainees.
Yeah, I think making connections is really how you learn. So I think it's a great thing what you're doing. Well, let's close with the last question. What are your plans after residency?
I ask this myself pretty much every day. I'm still trying to figure out what I want to do. I think it's very hard to say because I have a feeling that I'll probably have a job that does not exist today. And so I can't describe it, but I do know that I want to get the tools and the skills that will prepare me for most things and keep the most options open. The challenge of family medicine is that we don't have the luxury of saying this is not the body system that I'm responsible for, because we're responsible for the biopsychosocial model of medicine. Like, we care about the care coordination, we care about the patient's pathophysiology, and like all of these things relate to each other. And I really like that. And so I want to try to get the full skill set to take care of all of it and position myself so that I could, be a doctor for any community. Who knows, maybe I'll work at an Indian health, reservation. Maybe I'll do locums work as a traveling doctor, kind of filling gaps in different communities that maybe a doctor leaves for whatever reason. Maybe I'll work at an academic center. Maybe I'll start my own practice. I have a lot of interest, quite hard to pin it down at this point. I think right now I just want to become the best clinician that I can, and we'll see what happens.
Excellent. I was gonna tell you, I was just hearing a podcast the other day, and they were describing primary care physicians. They're really healers with scientific knowledge. So, because we really heal the patients, and I mean, you have to listen to, like you say, the psychosocial component, which is really important. But anyway, Paulius, it was a pleasure having you here, and I hope we can do this again next year, maybe, when you know more of your plans after residency. And we'll keep in touch.
Absolutely. Thanks for having me.
Okay, take care.